Okay. Good evening, everyone. I'd like to call to order the June 24th, 2026 CMH Full Board Meeting. Please rise for the pledge. Next will be the reading of the mission statement by Sharita.
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provided quality services which promotes recovery, community participation, self-sufficiency, and independence.
Thank you. Next item is adoption of the agenda. I'll take a motion to adopt. Motion from Megan, support from Dana. Are there any questions about the agenda? Hearing and seeing none, all in favor say aye. Aye. All opposed? Agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak, you can come up to the podium. You have 5 minutes. Anybody wishing to speak? Okay, seeing none, we will close the first hearing of the public. There is one more before the end of the meeting. We'll move on to item 5, which is minutes. I will take a motion to approve the CMH full board meeting minutes from Wednesday, May 27th, 2026. Motion from Antoinette, support from Sharita. Comments, questions, changes to the minutes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. Item 6, standing committee meeting minutes. We had none this month. So we'll move on to item 7, request to approve. Item A is a request to approve a lease closure not to exceed $25,000 for a group home. I'll take a motion to approve. Motion from Selena, support from Antoinette. Tracy, did you want to speak to this one?
I'm happy to answer your questions, but just at a very high level, this group home is being closed because the provider doesn't have additional individuals and there's not another provider who's willing to take over the home. We do currently have on average 50 vacancies in our group homes, but just to be very clear in that, I don't want to misrepresent this. A lot of times, it's not for the lack of efforts of our providers, right? It's there is not maybe something they're able to take because maybe it's an all-female home, or maybe it's a IDD home, or maybe there's some circumstances, or the person doesn't want to necessarily go there. It's just matching that there. I only say that because if someone told me that a group home was closing, I would be concerned without knowing that particular information that I just shared. This home has been in existence, forgive me, it's in the write-up, I don't remember if it's 26 years, give or take. It was actually originally leased by the state of Michigan, then us in turn. And although it's been maintained, I'm sure you know over those many, many years, things maybe don't get as maintained as well as they should. Some of the costs, we've inflated a little bit, that's why it's not to exceed, just in case. And then also in that, the provider is actually compensating for part of that dollar amount. So the end result won't be that full dollar amount. But we are partners in this in the way that the provider is covering some things that maybe they should have been doing prior to closing it. And then, of course, us in order to meet the basics of the homes before it's turned over to the landlord.
Thank you, Tracy. Any questions? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next is 7B, request to approve the use of the MDHHS approved grant funds for the integrated healthcare supplies, events, promotional materials, and evidence-based practice training for the CMH network. I will take a motion to approve. Motion from Dana, support from Selena. No, Jackie. Close enough. Leslie, go ahead.
So we are just requesting to move some of the funds around in what was already approved by the state of Michigan and by this board in order to meet the needs of the community. We had an overwhelming, higher than we've ever had before, interest in the garden project this year. We have a huge number of providers participating, so we had to up that amount. Some of the evidence-based practice trainings that we had scheduled and had estimated to be at higher amounts actually ended up being less, including the critical incident stress management training, which is a training to teach groups of people how to respond to community crises, to support our community in the event that there are any critical incidents across Macomb County or in our neighboring communities. So we estimated that to be more than it actually ended up being. And likewise, we had a couple of other evidence-based practice trainings that were slightly more expensive than we expected them to be. So we moved some of the funds around just to make sure that we were able to pay everything and be transparent with the board and the state on what the costs were going to be for those different items. In the bar that I believe you all have in your packet, and I don't want to misspeak, but I know Sandy's really fantastic about that. I highlighted, just for ease of reference, what was being changed, what was originally approved by the board, and what we are proposing the new amount to be. And this was approved by the state. It's ready to be submitted in e-grams once our board approves it.
Thank you, Leslie.
And then I just must add, per Jeff's request, that I remind this board to please attend the Integrated Health and Wellness Fair in September at the MISD.
Good plug. Thanks, Leslie. Are there any questions for Leslie? Okay, hearing and seeing none, we have a motion and support. All in favor, say aye. Aye. All opposed? Motion passes. Thank you. Next, we'll move on to item 7C, request to approve the 2026-2027 CMH Leadership Development Program. I'll take a motion to approve.
Support.
Motion from Donna, support from Megan. Tracy.
This would be our fourth annual, when I say annual, it's about 8 months, give or take, program in which we select 12 to 13 individuals and then one of our executive leadership to participate in a training. Just as a reminder, it is an 8-month-long program, but they do average 4 to 6 weeks in between training. And the reason why that is they learn a subject that's a full day. They then do some hands-on activity that they have to kind of demonstrate what they've learned. They also are assigned a rock or like a project, right? That over that it's about 6 months that they do that. And they have to identify as leaders what is a problem, a gap, a challenge within the organization, and it's supposed to teach them project management, leadership, and becoming. The end result of all this is, if you notice, we call it leadership training. It's not all supervisors. Our organization very much wants to have a culture of, if you are a person who works here, you have leadership over something or someone or lots of things. So if you identify a problem, you should be empowered in order to resolve that. And let's just say you don't have the authority, you should be the one who brings up the idea and tries to work along with that. And of course, always happy to answer any questions. It did go out Monday for this cohort, so I'm hoping you're still supportive of this activity. If you do want a participant who has went through it, Matt doesn't know this, but Matt's here, Leslie's here. I'm sure they'd be happy to answer any questions if you want it from the participant perspective. I know, Donna, several of you went to the actual product or the project kind of presentation, so of course you all can also speak if there's any additional information needed.
Thanks, Tracy. And I know you highlighted that during our Metro Region dinner last night too, and I thought a fun fact was that our staff that go through that program stay with us. We don't train them and they, go off other places. They stay here, which I thought was really
So far,
cool.
36 people, and all 36 people still work here. So that's amazing, and we're very appreciative of all that they've done. Matt, I don't want to pick on Matt. I feel bad he just showed up randomly, and I don't. But Matt is a great example of somebody who went through it and has excelled before, but also excelled after, and it gave him some additional opportunities to be seen.
Matt, surprise. This is like church in class where you sit in the front row and you get called on, even when you're
Hopefully
not
you're
expecting
taking
it.
it as a full compliment of thank you for being here, and you do a great job.
Really appreciate it and the opportunity to take place in the leadership.
Thank you. Thank you, Tracy. Are there any comments or questions for Tracy? Donna.
I know Lori and I have been to the presentations and the graduations, and I'd encourage the board members, if you can, if you can get your schedule to try to go to them. They are really very, very awesome. And the presentations are top-notch. It's unbelievable, the ideas that they come up with that can really, really make such definite changes within our culture for the people that we serve. I mean, I've just been blown away by some of the ideas that they come up with, and their presentations are just, I've been so impressed with these presentations and the expertise and the professionalism that they show. So if you can, when you get the email that they're going to be doing their presentations and then the graduations, try to fit it into your schedule to go, because it is just awesome to be there and watch them. And what they've really put together to present to us is just really something unbelievably great to go to. So I'd encourage all the board members, if you can, to attend. It's really something worth making the time to do. Thank you.
Thank you, Donna. Any other board members? Okay, seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next, we'll go on to 7D, request to approve contracting with multi-language services for written translation of the MCC-MH member handbook into Arabic, Bengali, and Spanish. I will take a motion to approve. Motion from Selena, support from Julia. Nice. Helen or Tracy? Either one, both. Helen, go ahead.
Yeah, thank you. So this is a request, every couple of years or so, we update our member handbook, and anytime there's any significant change, we also then translate it into our 3 most requested languages that, for individuals that we serve. This is just a quote on the most recent one that we'll be needing. As you see, we got 4 different quotes. The lowest quote actually came in from the same agency that did it for us last time. Did a great job for us. They were on time and very, responsive to our needs. So that's who we're recommending to move forward. And just, if you have any questions, let me know.
Thank you, Helen. Are there any questions for Helen? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next is item 7E, request to approve a 90-day contract extension with Raymond. This has been approved by legal. I'll take a motion to approve.
Support.
Motion from Sharita, support from Megan. Tracy?
This should look very familiar too. This is the second time we've extended it. The only motive here is there are competing priorities in our system. And both Raymond and our organization has been challenged in order to get some things finalized, but we'll continue to work for it. And of course, Drew is here if you have any, I don't think there's any specific details, but you're also welcome to ask questions.
Thanks, Tracy. Are there any comments or questions on this item? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Ken, we get to keep you for 3 more months. Yeah. Next, we'll move to item 8, which is receive and file 2026 QAPIP work plan, provider satisfaction survey results from Tema, and now Matt gets to come up. I will take a motion to receive and file the presentation. Motion from Dana, support from Sharita. All right, go ahead, Tema.
Good evening, everyone. As part of the QAPIP work plan, we have to assess the satisfaction rate of our providers. So this past April, we did a satisfaction survey with all our providers, and Matt is going to start off by presenting the results that we received from our providers.
Thank you, Tema. As Tema explained, I'm here to review the 2026 Provider Satisfaction Survey results. If while going through this I'm speaking too quickly, or if someone happens to have questions, please just let me know. I'm happy to pause and explain in more detail if need be. Moving on to slide number 2, the methodology. There were no significant changes this year from other prior changes, aside from adding 3 additional departments to our survey that were not included in 2025. Those departments are the clinical informatics, customer service, and crisis service departments. For those that aren't familiar with the clinical informatics department, they're the wizards who in the background do a lot of things with the data and then produce a really easily accessible dashboard for us to review internally and for outside provider agencies. So getting feedback on what they're able to provide to our network is really valuable for us this year. And as always, all the responses are kept anonymous and confidential, so we can be certain that we're getting open and honest feedback. There were Likert scale surveys, so anything from strongly satisfied / agree to strongly dissatisfied / disagree, and open-ended questions for a total of 72 questions, 13 of those being open-ended and 59 of those being Likert scale. As for the demographics part of the survey, we will see that in 2025 there are 61 completed surveys versus 85 this year. There were more outreach efforts that we had before the start of the survey and during the start of the survey, but the primary movers there were the increases in SUD responses and CLS/respite responses. So Nicole Gabriel from the SUD department deserves a lot of praise for getting the additional responses. The majority of those additional responses are her responsibility and her doing. We can also see that as far as staff roles, we had very similar sort of staff roles completing this compared to other years, primarily executive leadership and program/clinical supervisors, followed closely by staff providing direct services. For the quantitative review on slide number 4, I thought I would open this review with the very last question that we have on our survey. That last question is asking whether or not overall you're satisfied with the collaboration partnership with MCCMH. We can see that for 2026, we had fewer disagreeing and dissatisfied responses and fewer neutral responses. We had many more agree responses versus slightly fewer strongly agree. I think this is largely indicative of what the overall trend is, and the rest of the quantitative and qualitative review will validate those findings as well. Moving on to the next slide in the quantitative review, we can see that there's a department by department comparison of 2025 versus 2026. And you can see that for the most part, in fact, in every example, each department has dropped in their average scores versus 2025. The reason for this is because there are many more neutral responses from CLS and SUD providers. And digging a little bit further, we're able to see that most of those individuals that were marking neutral for those responses also indicate in the open questions that they were not the subject matter experts for that particular area for their department. However, they still filled it out. So we believe that correcting for those neutral responses does bring us very close to the same department averages that we had the year before, just that there are many more neutral responses. In next year's surveys, we'll do a better job of trying to highlight that only subject matter experts fill out these in these particular areas versus someone filling out the entire survey. Likewise, each department does answer different questions. So while this is there so you can look and compare between each department, it's not necessarily a very fair comparison as each department does have their own criteria that they're graded on. As far as areas for strength, we can certainly see that our professionalism scores very, very highly compared to every other area. Clinical informatics at the end here, we can see it has a score of 3.6 as the lowest score versus 4.2 and the highest score for quality. Informatics does ask some slightly different question about their professionalism. So while 3.6 is the lowest score, I would suspect that if they ask similar sort of questions to the way the rest of the departments do, that they would probably be more in line with the average. And then for the dashboard decision-making insights, we are able to see here that there's a lot of strong support, both quantitatively and qualitatively for the dashboards. There are particular mention of individuals or of agencies repeating that they're able to save time and the administrative burden for staff because they're able to see in quick detail the sort of responses they need out of the dashboards. For the qualitative review on slide number 7, we can generally see the core values of MCCMH really shining through here. So we're able to see the accountability, the respect, and the collaboration. Collaboration and a collaborative partnership was the most frequently mentioned term positively in the open-ended questions. People in particular compared us to other PHPs that are in the area, saying that we tend to be more collaborative compared to other agencies and more open-minded and able to listen to what some complaints are. In much the same vein, we are viewed as being very helpful and dedicated staff members. In particular, Adam Wright, Kendra Casper, Laura Hitzelsberger, Nicole Palazzolo, Tracy Smith, and Helen Klinger were mentioned, with Adam Wright being mentioned the most often. And then we are also mentioned fairly frequently as being generally committed to our consumers, as being a PHP that has actual belief in trying to make changes for our community at large and for the individuals that we serve. And that is also in comparison to other PHPs that people mentioned. For slide 8, some of the negative trends that we're able to see, we are able to notice that people are reporting communication breakdowns at times. In particular, they're mentioning that information may differ when asking one department versus another department. Oftentimes, this occurs between quality, MCO, and network operations, and typically it's after a change that has occurred within the last few weeks, and then asking another department about that change they have, and we are unaware of those sorts of changes. They also mentioned that response rates differ department to department, so one department might be more responsive versus another department. As far as the authorizations, we're able to see as being another area of contention. This is much in the same vein as it was in the year before. There are frequent mentions where there is not enough information and that medical necessity is just being boilerplate language spit out, highlighting where the medical needs might be, but individuals are asking for a little more detail so it can be more person-centered as opposed to something that just feels more like boilerplate responses. And lastly, the audit burden is the third most complained about sentiment that we're seeing with open-ended questions. Largely individuals mentioning that there are multiple audits going on simultaneously. We are working with across our organization with other departments to see who else is completing audits. We do want to know that there are many audit timeframes we don't have much control over. The state says this is when the audits is set to be done, and that's it. And the individuals or agencies that are complaining about the amount of audits going on simultaneously also happen to be the agencies that have multiple PHPs that are doing the same audit at the same time. So fairly, they feel really burdened with the amount of audits they're being asked to do, rightfully so. And then that is all for the qualitative and quantitative review. It's a rather high-level review. Are there any other questions or details you'd like me to review in more detail?
Board members, any comments or questions?
I'll let
I'm not surprised by the audit piece. I think we've all heard that one, and I think even at the Metro region and conferences, it's not just a Macomb thing, that's a whole state issue, so that one did not shock me at all.
No, even us auditors think there's a lot of audits going on.
Yeah. Yeah. So for our next step, we actually take these responses seriously. What we've done so far, we've distributed the results to every department. So right now, every department head has their raw data to see what the providers are saying. And the request is that at the next quality committee meeting, each department head is going to present as to what they plan to do or how they can help to address the challenges that we have seen in this survey today. And at the end of it all, we are going to go back to the providers to explain to them the initiatives that we are taking to improve some of the concerns that they have. And for the ones that we have no control over, we're going to explain the why to them.
Thank you, Tim. Are there any comments or questions?
May I add?
Tracy, you may add.
So in a real life scenario, what happened is Tema distributed the information to the different departments and they had the best reaction ever. They were upset, right? Like in a good way, like you should be if something needs to be better. What I mean by that, not upset like I'm mad, but like, wait a minute, right? Like I need to do better. And they got kind of all talked about it. So I think I always get impressed, but I was like impressed. I'm like, I'm glad you're upset. That's great. Because that means you're not okay with, something that needs to be better and is pointed out. So.
Thank you.
Okay, I see no other questions or comments. We have a motion and support to receive and file. All in favor, say aye. Aye. All opposed? Motion passes. Now we'll move on to item 9, which is resolutions. We have one for Mary Johns, who was a member of our staff for 31 years. Tracy, actually, take a motion to approve the resolution. Motion from Donna, support from Selena. Tracy, go ahead.
Especially when someone's not here and you read something on paper, sometimes it just doesn't translate to real life, right? So I guess I'm going to give you my personal experience and kind of with Mary. If you interact with Mary, you're always going to get a smile, right? If you see her, you're instantly, it doesn't matter what the subject it is, when she assisted with payroll and numerous types of office assistant activities in her 31 years. I don't ever recall, not that I was here for 31 years, but in my experience, I don't ever recall her saying, well, I can't do that or whatever. And she was always the first one to jump in. And she was also very good about reaching out to say, hey, this isn't working, or what about this, or what about that? So I guess I wanted to take a moment to explain it from that perspective, because we have a lot of fancy words on paper, and sometimes it just doesn't come across. So if anyone knows her, and hopefully we'll get to, we will share the resolution, but hopefully at some point the message that was shared here today.
Thank you, Tracy. Any comments? Donna?
You know I know her.
Of course.
I had the honor of working with her all my career, really. She worked at First Southeast. And I think that the resolution says she was the go-to person, because she was. I mean, everybody ran to her with problems. And she was always really good about it. Like a lot of people would probably say, get out of here. She never did that. I mean, if you had a problem with your payroll, you always knew who to go to, because Mary would always resolve it for you. I mean, if your paycheck had something wrong with it, go to Mary. If you needed time off, go to Mary. If there was ever any kind of difficulty, everybody went to Mary for everything. And she was always so good-natured about it. And she was also a friend, too. Her husband actually owned a pet store, at 16 Mile in Van Dyke, and we used to go there for all of our pet supplies because we knew Mary, you know. So I think he finally sold it. He had it for years and years and years, and she was also a very good friend. She's a wonderful person, and I wish her only the best after finally retiring after all these years. And she's a wonderful person and a wonderful employee, and I wish her the best on her retirement. Thank you.
Thank you, Donna. Anyone else? Well, congratulations to Mary, and we will get that resolution to her. We do have a motion and support to approve it. All in favor, say aye. Aye. All opposed? Motion passes. Now move on to item 10. I will take a motion to pay the bills. Motion from Antoinette, support from Sharita. Comments, questions? Hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Now we'll move on to management reports. First is Ken with the CFO update.
Good evening, everybody. We'll start on page 50 of the packet, where we have our revenue and eligibles trends. We've actually seen a steeper decline in April than previous months, which is unfortunate. As I mentioned last month, we continue to advocate with the state of Michigan, particularly on this is a very solid data point to point to. We have these, what we're seeing for enrollment, here's what you put in the rates, they don't match. So we are hoping to get a mid-year rate adjustment as it pertains to that. The state has verbally said that they're working on that, but we do not know when that's going to happen. So we'll stay tuned for that and keep a close eye on that. I'm going to flip ahead to page 53, where we have our funding source breakdown. As usual, we'll take a look at the top two boxes. If you add those two deficits together for both Medicaid and Healthy Michigan on our capitated funding, it's roughly $6 million through April. You project that out, be roughly $10.3 million pull from the ISF in fiscal 26, assuming all things stay equal. That's not an unexpected result. We had budgeted actually for a little bit more, so it could come out a little bit worse depending on how we go. These are interim numbers, but that's what we're seeing there. At the bottom of the page, you can kind of see the breakdown. We'll actually have to pull some of it out of our Medicaid savings, which is a different, I'm going to call it reserve compared to our ISF. We have both. But the savings number is calculated directly off of revenue because our revenue is considerably lower this year due to the CCBHC reduction. That number then trends lower as well. So I think we're going to have to pull some dollars out of there. So we'll use some of that to adjust that to our revenue, and the rest will actually come out of the ISF. So it's actually a mixture of those two things at the end of the year, but $10 million will be coming out of our different reserve vehicles that we have. CCBHC are the next two boxes. Again, we would add those together to kind of at a high level look for Medicaid and Healthy Michigan. It's about a $2.7 million loss through April. Just candidly, the CCBHC direct pay continues to be a kind of a roller coaster ride from we continue to work on our system, our EMR, to get the billing out the door in a complete fashion. We're not the only ones struggling with that. Statewide, we work with PCE constantly to try to identify those things and streamline it. Operational things where under the previous method where we would send encounters, there are different edits on that compared to the direct billing now. So we're bouncing up against some of that and trying to work with the state on that. So we're trying to collect as much as we can out of here, but we are running a loss through this point during the year that's very much tied to the direct pay problems that we've had. So I'll stop there real quick if there's questions on this page.
We'll do Nick, you had your hand up, right? Nick and then Donna.
my question wasn't on that page, but at the beginning of your discussion, you talked about rate adjustments, and I didn't catch what you said. I just want to know if there's any discussions on rate adjustments to accommodate the changes in the minimum wage law.
I am not aware of any rate adjustments to accommodate the minimum wage law, strictly related to the decrease in eligibles. So eligibles are just trending lower through the year than the actuaries predicted.
Yeah, and
So
eligibles are going to trend lower once HR1 goes into effect.
in my mind right now, we're kind of seeing like a slow decline. When HR1 comes in, we're
See rapid
probably
decline.
steepening the curve, if you will.
But
Yeah.
it seems to me that we have, if the law requires that the rates be actuarially sound, which means they gotta accommodate, if they don't accommodate legally mandated increases in costs, that, I think, gives us a strong, I think that's an argument that needs to be put on the table.
It is, and we are actively, as a PIHP CFO group, gathering that information. Richard has done some calculations about not only what he thinks the 1/1 of 26 minimum wage and that was underfunded, but looking forward into 1/1 of 27, and it's the disparity is huge between those two numbers. Now, Richard's made some assumptions about how he came to his, but we are unable to get really detailed information about how the state calculated their number. As a reminder, for 2026, statewide, they only put in $23 million for the minimum wage increase. I think we were thinking that it would be maybe 200 million would have been a more reasonable number. When we look at 2027 and the next one, Richard said today, I think he's looking at 300 million. Statewide would be like a reasonable number, and that's not what's being floated at all. So there's just, I think the way they're calculating it is they're raising the rate, like to accommodate the wage increase, but there's a lot of costs that come along with that. And it causes other downstream problems, such as wage compression. What do we mean by that? There's supervisors that could have been there for a long time who are now only making a little bit more than someone that just came in because of this. So, when you try to factor all that in.
Well, there's wage compression, there's the cost itself, which I think is more than appropriate, because quite frankly, if we don't increase these wages, we're already having trouble attracting and retaining workers, but you also have to talk about the statutory benefits, the costs of those that
Oh,
go
yeah.
up, connected
FICA,
with the wage,
pick a thing.
FICA, et cetera.
Yeah.
And there are some other things we should be doing, but I don't know that we can do without building it into the rates.
I totally agree, and those advocacy efforts are ongoing. Tracy and myself and Helen and others met with the Macomb Provider Alliance today. Lisa's here, just like an hour ago, and they're trying to work on those advocacy efforts at the statewide level. It's so important. I think the providers getting behind us on these things or leading the charge is really important. I mean, we engage with the state a lot, but I think hearing it from a lot of different angles, other counties are doing similar things to try to advocate and present the case of this problem. 2026 is an issue, but 2027 is a big problem if they're not going to fund this. So
Tracy's wants to jump in real quick. And
sure.
Yes, and now that it's been so long, it's gone from my mind. I guess definitely, Lisa Kerr, if you're here, you're welcome to say anything at the end when they do the provider comments from your perspective too. But if you want to learn more about this, it is in my board reports that I'll talk about after Ken on a very high level, but also just a reminder, which is also in your list, there is a legislative committee that is occurring tomorrow, and this is one of the items from an advocacy.
Friday.
Oh,
Right.
We're not to Thursday yet.
Feels like it.
I know.
My bad. Friday, so if you're, I know the information has been sent out.
Yeah, the Policy and Legislative Committee meeting is Friday at 9 o'clock at the Hall Road office. For those of you who are on the committee, if there are other people, other members who are interested, please feel free to join us. It's an open meeting, obviously. And we sent out, with apologies to Sandy, we sent out a lot of information with that. I hope there's an awful lot that we need to deal with. So I hope you have a chance to review some of the material ahead of time.
Yes.
Donna?
I think I heard you say that to pay everything in this report, we had to go into our risk reserves for 10 million?
Yes,
Yeah.
That's
So,
year-end projected, yes.
okay, so, like, I'm going to relate it to my own bills. Like, if I had to go into my savings account to pay my bills, that would concern me, So are we going to have to do that every time now that we go in to pay things? Because that would be, that's concerning me. Like, as you were going through this report, I was getting very concerned because if we keep doing that in our risk reserves, we're going to run out of money. Yes or no?
You're right. I mean, it is a concern, and it's one worth having. I think that's why we tie it into the rate and advocacy efforts. I think if we
Okay.
pull, even if you look at the schedule down here at the bottom, right? If we pull, at the end of the day, if we pull $10 million out, if you annualize that number, we still got $74 million sitting there. Now, put a pin in that because I think we might need a bunch of it for 2027, but it is why we have it, so that, if the rates did not go our way this year, so we can, ideally in a future year, it would swing the other way. Maybe we could put a little bit back in while still supporting our providers, right? So even though we knew we were gonna pull out of the ISF this year, we did 3% generally across the board rate increase to continue to support the providers. Our own staff received an increase, so we're trying to, it's a fine balance between those two things, but it is a concern. But I
Yeah.
think we're,
Yeah, I don't want to be apathetic about it because, I mean, that causes me a lot of concern because I've been here when we didn't have money. And I know what it's like because then we start looking at cutting staff and cutting services. And believe me, that is a nightmare. You were here when that started happening. It's a nightmare when you start looking at cutting services, cutting staff, and, that's a concern. So,
And this is why we've been so adamant about the calculation for the ISF and what we've been able to put in annually. That's why we felt we were putting in more and more and more, because not only did we have it, but we felt our calculations were correct for this very instance, right? Because we saw this coming. We weren't blindsided by this. We were trying to prepare for this the best we could to the maximum that we could, right? And so when this day came, or when it comes, we would be prepared and we would be covered.
right.
And we're still fighting that fight.
We are still fighting that fight. I mean, to your point, Phil, depending on how that may or may not shake out, that does bring this number down that I just mentioned. So we're assuming that our calculation is accurate, and that's what this is based on, but.
thank God we have the reserve.
Oh, yeah. Yeah, if we, there would be additional issues if we did not have these funds at the bottom of the page.
Yeah, I just want to reiterate, I think they've already said it, but just to hear from a third person, that although you should be concerned, because we need to be prudent, at the same token, that is what it's for, right? Because that's how this works, right? These unpredictabilities. So it's essential, and we do need to just be really smart of when we do it and use it. We know it's the decision, and we're extremely supportive of dipping in this way to ensure the providers are able to sustain the services that are in the community.
Good question. All right. Let's go to the next page, page 54. I don't think there's any surprises here. Our non-Medicaid spend for CCBHC is trending as expected. We don't expect to get a ton of dollars to cover that, but And the CCBHC program as a whole, it's been fiscally sound for a number of years. State General Fund, the next box there, we're doing well there from an expense management perspective, so we're running a surplus there. We are allowed to use any surplus there to cover CCBHC non-Medicaid. And at the end of the day, expecting to put about $5 million still in our local fund balance. So I do want to highlight here, because the financials look different than they have previously. When you look at this number, this $5 million, used to be able to tie that back to our change in fund balance. The reason that it's negative, our change in fund balance, is because that draw on the ISF. So it's kind of a weird scenario where I think we're still going to put money into our local balance while taking money out of our ISF. And when you net those together, it's actually a negative number. So in case anybody was trying to match those two up, that's what's going on there. So it's kind of a good news, bad news, where in the worst of rainy days, this $5 million would be available to cover any number of things, including Medicaid deficits. We do not want to get there. But this is why we break it down by fund source, to show those, how each thing, they're somewhat independent but act together as well. Any questions on that? Or I get into a few narrative things? Okay. We touched on HR 1 a little bit. I just wanted to highlight that I'm trying to think if we met. I don't think we did. So the federal government issued their final rules, I think is what they're calling it for that. It's quite a lengthy document. The state, we had a call with them, I think 2 days after that was dropped on June 1st, I want to say. So I think they're still trying to digest all the details and how they're going to put that into policy. It's concerning for a lot of reasons, right? Certainly from a person's perspective, that they may not get services, any number of services. Healthy Michigan, I think, is going to really take a hit. It's been kind of targeted, if you will, for the work requirements, the semi-annual recert. There's going to be a lot of heavy lift with that at the state level, I think, and revenue will drop considerably with Healthy Michigan. That's a chief concern from a finance perspective. We are doing some work to look at our policies and procedures, particularly as it pertains to non-Medicaid spend. So we might have to make some adjustments there, as people may be rolling off of Medicaid in large numbers. Our GF and non-Medicaid funding may not be available to sustain that kind of pace. So we're looking at that internally to try to figure that out, but wanted to make the board aware that we do have to consider some of those things for people that may be underinsured, that number could go up substantially. I already touched on the 2026 rate amendment. We were supposed to have a 2027 rate setting meeting on Monday. That was canceled, so we are not sure what that's going to look like. We usually get those in September anyway. And then the last thing was budget. We don't expect to have rates. Expenses we can get to where we think they want to be, but it's a question mark. I mean, we'll bring something our best, as we usually do, but it's possible we're coming back with a mid-year amendment to try to right fit that. Trying to predict how HR 1 is going to impact the budget is, I don't know how to do it. There's not data or anything I could pin it to, so we'll keep an eye on it as we go and go from there. So I think that's all I had for those items.
Thanks,
Any other
Ken.
questions?
Are there any more questions or comments? Okay, don't see any. Thank you, Ken.
Thank you.
Now we'll move to the CEO update from Tracy.
Earlier today, you would have received the board report. It was about midday to be helpful if you're trying to find it in your emails. I'm going to just highlight what's in there, just as a friendly reminder. Even though I'm going to do some highlights, I would highly suggest if you already haven't to go in there and actually click on the information so you can really read it. I do think it's valuable and a valuable way for you to hear similar information at a deeper level so you better understand it. But the main areas we're just going to highlight first. When it came to media last month, this month, there was numerous features. You should notice an increase in comparison to the previous month. There was a featured article about the children's services, the SUD and center. I think many of you already know this, but we've actually expanded eligibility to that. So right now it is at anybody who's been under the influence in the past 7 days or at risk of relapsing. So it used to be 3, is that right, Hal? 3 or 2? Yeah. So we're trying to expand the services and really basically we want to make sure we're following the model, but at the same time being open-ended as far as if the person needs help, we're there for them. We're also highlighted a quote for the Rising Stars. If you haven't read it, they have a great partnership coming up, and it's a great organization we currently have a partnership with. There's also a few features right before the Mental Health Matters Awards on WXYZ that I've shared with you. So those are the highlights about some media in the last 30 days or so. If you didn't get the opportunity to participate in last night's Tri-County dinner, I did attach in there the presentation that we did, right? And it does give a high level in there about what the activities have been. It also highlights, if you haven't checked it out, please check it out. We have the new feature of PDFs. Any PDFs on our website now are ADA compliant. What I mean by that, it has the ability to create a transcription of everything under the sun, including our rack cards, one-page flyers. The benefit of having that transcription is then if the person has a reader, it will do it. And what I mean by a transcription, if there is a logo, it describes what is there. It's not just literally reading. Because sometimes if somebody has a piece of paper, if you don't give them context, right, of the whole thing, so it does a good job of kind of telling them what is appearing on that particular piece of paper. It also translates into hundreds of languages. And what's very cool is when you translate it into one of those 100 languages, it then also translates the rest of the directions. So then they know how to print or whatever they're trying to do at that moment. Other things it offers, it uses AI in order to, the example I give people, if you pull up the SUD Engagement Center one-page flyer, over to the right, there is a question that it suggests you could ask, like, who's eligible for the SUD Engagement Center? Or they can type in any question. When you do that, it then searches the document. It then answers the question, but it also gives you, it highlights right from the section it kind of took from it. But it's intelligent, again, in the way that it highlights it, but it also takes the whole thing and tries to answer the question based on the whole context. Other things that it has is there's a checkbox that then changes it into dyslexia-friendly font. It also does color inversion, so if maybe someone struggles with that. And it also does spacing, right? So someone wanted larger spacing between the words, it does that. And then there also is a free online reader and or ADA assistance. So what happens in there, it actually makes the suggestion. It says, click here, and there's a free 30-minute assistance where this document can be read to you and or facilitated by this free service. So we think that's very, very cool, because what that basically means is anything on our website, if it's a PDF, and that's what, of course, we're going to put a ton of stuff on there, everyone, including our staff member who was meeting with somebody, they could simply go in there, change the language, email it to them, print it for them, whatever it is, to any document that we have out there. So that's a great, it'll take us time to get more out there, but I just really want you to check it out if you have a minute, and there's a link in there. Secondly is we finally have our draft version of the searchable transportation guide. You do have to have a password. We're not very secretive, so the whole world can know it's transportation for now. We have it in that way, not publicly on the website that just anybody can use, because we want to use a period of time to get feedback. We don't want to put something out there and it's not really that helpful, or maybe we missed a resource or something like that. It's very, very simple. Someone can type Sterling Heights. So it's going to give them the transportations in Sterling Heights. They could type medical. So are there medical transportation specifically? It also is a list that they, of course, can print. They can download it into Excel. It gives the phone number and the websites, real basic information. It's not designed to answer all questions, but like some basic resources that are available specifically in Macomb County. And we also presented that last night at the Tri-County dinner in kind of hopes that maybe that could be expanded on a larger scale, because transportation, just as you know, doesn't stop at DeQuinder and 8 Mile. Okay, so now the fun part. Remember, every month we try to do board education. So in there, you'll hear this again, most of this, if you go to the Fridays Legislative Committee. But there is information I would encourage you to read through about House Bill 6022 that we are and need to continue to advocate to oppose, or at least get other alternatives. House Bill 1000 and 1001 is highlighted, that we are trying to advocate for some edits. There is also the state budget and the boilerplate that we are trying to get others to support, and Nick has been doing a great job of making us that move forward from an advocacy standpoint, and also pestering me in the best way, as he should, for that. And then, of course, the minimum wage. So you'll see in materials on the minimum wage, the concerns about the gap that Ken was just talking about and Nick that brought up. So that will be our other advocacy discussions. But again, please go to the board report or update so you can learn more about those subjects. Lastly, kind of a few announcements that are mentioned there also. If you did not know, the MDHS current director, Hertel, is leaving, and the interim new director will be Amy Epke, I believe it's pronounced, EPKE. And then kind of related or not related to that, if you go to what they call the MTMB, or the management division of the state, you might. DTMB. Oh, did I messed up the letters? DTMB. I was close. They were
3 out of 4.
right? I do provide the link for you, in case you're just curious. If you go to that website, what happens is the state of Michigan is required to publicize procurement, right? So they have publicized on that page, it just is a list, and it just says PIHP RFP August, and then a person, the same person who did the RFP last time. If it's helpful, last time this happened, they, on that same website, it might not have been June, but I'm giving an example. They said it would come out in June, and then they put it out in May, right? So this says August, which means they could put it out as early as July. It also means they could put it out as late as September. And to be fair, that website states that, right? That's how their system works. So we were, of course, perplexed and surprised, because if you walk through the timelines of that, let's just pretend like they put it out in July, right? So you have to have on average 6 weeks, 5 weeks, right, to publicize it, give response time. You then, I'm assuming, best case scenario, need 4 weeks for them to review it, which I think I'm being way too conservative in that, just to be clear. And you then have to negotiate, and then you then have to start a contract. So if you notice July, August, September, October, November, December, essentially, we don't know, could that be pulled off? Yes. Would it be pulled off effectively? No. So I don't know if I'm allowed to call on Nick, sorry.
Oh, yeah, go ahead, Nick. Sorry.
My bad.
I was so into the
Yeah,
presentation.
just to add to that, though, the boilerplate that we're talking about would prohibit the department from issuing those RFPs without prior legislative approval. So that's one of the reasons we think that, and that was included in the House version of the bill. The Senate did not include it. It's obviously a matter of difference, so it's being negotiated now amongst the leadership.
But I would point out too, Nick, and correct me if I misspeak in any of this way, but this, in theory, they would be trying to pull off before December 31st, and the new budget would be January 1st. Oh, my bad. So it's even less time for them to figure it out. My bad.
Sure, yeah.
We've been working really hard as the Tri-County area when it comes to the customers. We've also have assumptions, I'm going to call it, that Blue Cross could possibly be behind pushing things. What if we as the community, not just from the client perspective, but from organizational perspectives, fight against those who, the big companies, because we as employees get to choose what health insurance we want to provide to our employees. What if we fought in that aspect to show them that we have voices as well, and that's how we get to protect our people, right? Because if these companies are not the biggest companies, they can't keep shutting down us that provide to the people that are not as fortunate. Like, is there anything that we can do as organizations rather than just the in-house part of the organization that can help save or change the path or anything possible?
I think all advocacy in all ways is always a good thing, right? At the bare minimum, you're educating the people of why that decision matters, right? Like why you would want to pick alternatives or why you would want to support certain things, right? So again, any advocacy is welcome. Kind of in that vein, in front of you is like a survey that was recently done, and you'll notice it mentions, like, from a public perspective, whether they would want privatization and then whether or not they would vote for individuals who liked it. So I think to your point, that is also asking that same type of question.
Thank you.
Thanks, Rita. Anybody else? Tracy, did you have anything
I
else?
just have this, if you check it out, I do think it's helpful information to get a objective. This is given to the public on a large scale, just to get their perspective. But a little bit to Sharita's point, I do think we need to be open and creative about advocacy, open and creative about we don't know everything, right? So are there major areas of improvement in our system of care? Absolutely, hands down, and then some. So we need to be proactive in order to try to address those, regardless of the many punches coming at us or the many challenges coming at us.
Thanks, Tracy. Anybody else? Okay, thank you, Tracy. Now we'll move on to other possible agenda items. Some reminders, we have program and budget, which will be July 8th here at 6 o'clock. We do have a recipient rights advisory committee meeting Thursday, July 16th at 8 a.m. at the CMH admin building. And full board will be here Wednesday, July 22nd at 6 p.m. Any board members with any other comments for the good of the order before I move on? I don't see any. So we'll go on to provider comments. Are there any providers with us that wish to address the board? Any providers? Come on, Lisa. Yeah, I was gonna say, you made the trip. You might as well walk 20 more steps.
No. Hi, everyone. I'm Lisa Lapine. I am the Executive Director for the ARC of Macomb. I am also the Chair of the Macomb County Provider Alliance. I do want to thank everyone who was in our meeting this afternoon to discuss the issues that the Alliance is bringing. We are very appreciative of our partnership. I always like to say that before I say what I'm going to say next, right? I was listening to Miss Donna. We have the same concerns. This issue with paying the pass-through on top of minimum wage, it's killing us. There are providers that will not make it out of 2026. I have such empathy. And then there's those of us who are borrowing against our reserves as well. And our reserves are much different than your reserves. I heard the number and I'm like, dang, if I had those, I wouldn't have my problems. It is a huge issue. There are providers that don't even know that they're not going to make it through this year. Their problem is your problem. Our problem is your problem. We don't want to say that people aren't partnering with us, because they are. And we know that the money hasn't come to you guys. And we're figuring out everything we can in terms of advocacy and talking to legislators and everyone that can listen and will listen to us, that this issue has to be fixed. It absolutely does. But I'm going to lay it on a little thicker, like I did this afternoon, which is this. You've got the wage compression issue. I'm hiring people for as much as people who've been working in my office for 10 years. Excuse me, that makes me so sad. They want to leave. They will leave. I'm lucky. I have money in the bank. The ARC has been very, very blessed because you're not our only customers. Okay? I will work for anyone. I have different resources, and I will be here for a little bit. It is June 24th.
Mhm.
I have lost $75,000 this year. 75. That's June. That's halfway. 150,000 by the end of the year. I can't give raises. I can't improve the rates for the people who are the middle management. I don't get a raise. I'm so sad for myself. But I can't take care of the people you've trusted me to take care of. I can't take them on community outings. I can't replace my vans. I could put gas in the vans. And I have money. Because there's a peer out here who will tell you she doesn't. And she will close her doors. We can't exist. And if we can't, you can't. We take care of the people. You take care of us. And this isn't working. We are failing. And if we're failing, and if I'm standing here and telling you I'm failing, and I don't have an easy time saying that, I know I have peers that don't even know how bad it is for themselves yet. They keep hoping it's going to get a little bit better, that we're going to make this happen, that we're going to make it work. We've been through some tough times in this county, and I agree. We have to talk to the state, we have to talk, but you got to talk about the feds shutting down the HCBS. You have all these things that are coming at us from so many different ways, and mental health is at a crisis because we can't take care of the people that we're already serving. So I heard you. I don't want to eat into my reserves either. I want you to eat into your reserves to fix my problem. I absolutely do. I will shamelessly say that to you. I want you to help me fix my problem. But again, quantifying it. I am paying direct support professionals who deserve every bit of this money. $17 an hour to start. I have middle management who is threatening to walk because I can't pay them much more than that. And they don't get overtime. And just remember, you guys don't compensate me when I have to pay overtime, and I don't have enough staff, so I'm paying overtime. I have multiple administrators, bookkeepers, quality control people that I can't bill you at all for because they're not billable services to you. But I have to report to you. I have to give you your quality management reports, not yours, but the department's. Insert word, okay? I have to have supervisors. I have to have vehicles. I have to give transportation. All of those things are not Medicaid covered services. And I still got to figure out how to do it. And I'm at $75,000 on June 24th. I, on a hope and a prayer, will finish this year, and I will make a decision about whether I will continue to contract with you next year. Because January is going to come up, and when I make that decision, there are things that are going to happen. I'm going to give up my houses. I'm going to give up my day program, and you guys are going to have to figure out where they're going to go. But my peers are in the same place I am. So I am very thankful for the partnership and all the conversation that we're having regarding the advocacy that we're doing. I understand that the department has come up with some numbers. They have done some magic math. I don't understand where their math comes from. We agree as providers that this Milliman report, 7 providers sat at the table and answered it 7 different ways. Their math is wonky. I will go with any of you anywhere to talk to anyone who will talk to me about the problem that we have. Because at the end of the day, which is a comment that I'm hearing a lot lately and sticking out for me, but at the end of the day, the people that we serve are the only people who are going to get hurt here because the providers will be gone. And short of families being able to take back all of their loved ones, and they can't, it's not possible because some of them don't have them, right? We're back to state institutions. And that's exactly what we've been hearing, the direction we're going, and we don't want to have happen. So thank you for bringing attention, right? But I'm telling you, we're doing this already. The providers are dying on the vine. And we're appreciative of all the partnership, but we've got to figure out a way to rattle the cage a little bit differently. Thank you.
Thanks, Lisa. Anyone else? You want to come up? Come on. You made the trip too.
the director for Creative Care Services. And just a couple of things hit me. Donna, yours was one of them, just to say, like, you would go into your savings account. Well, Creative Care has already gone into their savings account to provide services for Macomb County people. And we just can't keep doing it. And it's not fair to the other programs that we run, that we're kind of stealing from them to make this work. And I'm just hoping that all of you can hear it and do whatever you can do. And we don't have budgets to dip into to take money from. So, you know, again, you guys, the county, is supposed to take care of the people, and the providers want to do that for you. And we've been doing it for a long time. I was 18 years old when I started in this field, and I was hoping to retire in this field at some day, but I think that day will be sooner with Macomb County if it doesn't turn around. So, thank you.
Thank you. Anybody else? I don't see anybody else. So we'll go on to hearing of the public. Anybody from the public? Seeing no public, I'll take a motion to adjourn. Motion from Megan, support from Nick. All in favor, say aye. Aye. All opposed? We are adjourned. Thank you, everybody.